Hi, everyone. It's Ben Manzo, financial consultant with IG Wealth Management. I hope you're doing great today. As you can see over my shoulder, the weather looks like it's going to be a great one. So please enjoy it. Before you go outside, though, please consider my video. Today, I thought we'd talk a little bit about health insurance and how to identify one's needs in that particular area. So, what am I referring to when I'm talking about individual health? And so, one of the things to consider, or a number of things to consider, are medical costs that you incur. Things like prescription medication, things like paramedical expenses, also dental expenses, any other miscellaneous expenses that pertain to your health. So, some stats to consider, and thank you to Canada Life for providing this information, is that every day for the next 15 years, 1,400 Canadians will turn the age of 65. So at the age of 65, most people will retire. Some will go on, but anyways, at 65, it's a significant turning point. If every retiring Canadian took a seat at the Scotiabank Arena where beloved Toronto Maple Leafs play, that would fill up every 2 weeks. And so what's even more staggering is that 75 to 80% of those individuals will lose their employer-sponsored benefits. So the big question is, what do we do when that happens? Of those employers that are offering retirees benefits, 24% are considering and looking at ways of how to cease providing benefits. So the first place you want to start is looking at an insurance needs analysis. So, some of you may have seen some of these questions before. Of others, if you have not seen these questions, well, this is a great opportunity to take a look. But you can see, do you have benefit coverage on your own? If so, is it through your employer or through a spouse? If yes, do these benefits meet the needs and do they continue at retirement? That is a significant question to ask oneself. And, with savings and retirement plan, is there a provision to provide private health insurance premiums? So these are above and beyond what's offered by your employer. Additional questions to consider, have you had health and dental coverage in the last 60 days? Who will be covered under this plan, including spouse, children, others that depend on you? Is there any pre-existing conditions? What are the more common medical expenses? Have you traveled outside of Canada? Obviously, with COVID-19, that's a big question that insurance carriers are asking these days. And do you expect to join a group plan and look in the future, or looking for coverage in the long term? So these are just some questions to consider. And what I thought I would share with you is what a good plan looks like today. So you can see here, based on an individual earns $80,000 before tax, they have roughly about 4,700 of benefit premiums in addition to that. So again, these are some stats shared by Canada Life. And as you can see, after retirement, those medical benefits and dental benefits, they do cease, and you're left with, in this example, 75% of your pre-retirement salary. However, what does a great plan look like? So as you can see, what we're adding here is an additional $3,500 to individual health premiums. So when you retire and you're left with 75% of your pre-retirement income, that leaves you with about $60,000 of income. But there's that gap, because if the benefits do cease, then we want to be able to provide a health premium package that can cover your needs. So please, as always, let's meet if you have no coverage in place right now. What's great about today, as we go through COVID-19, although it's not a pleasant experience, is that a lot of the insurance carriers are providing instant ways of submitting applications through e-apps, et cetera. So this gets to the underwriters very quickly. If you want to determine your current and future insurance needs as they will continue through retirement, let's meet, let's get together. And if you further want to understand what your employer is offering, or even from your spouse's employer, and you want to see what else you require, let's talk. I think this is a big one. I know, as I've always looked at what benefits, with future employers, I wasn't sure, how much coverage I had, or I always had to refer back to a benefit statement. So please, it's important that you understand what you currently have. And if you're looking to join a plan to help, fill that gap in future, please do reach out. Again, those that are retiring, or today if you are self-employed. So thank you as always. Please take some time to think about what I mentioned today. Follow me on social media. Happy to answer any questions you have. And thank you so much. Stay safe and all the best to you and your family. Take care.